Welcome back! Today, I'm going to continue our conversation about the Women's Health Initiative, which was this large landmark study in the 1990s that informed, or rather misinformed, a generation of doctors and their patients about the dangers of systemic hormone replacement therapy. In going back and looking at this data many years later, we realized that some of the conclusions that we jumped to, assuming that all hormone replacement therapy causes heart problems and strokes and contributes to a risk of breast cancer, isn't necessarily true. And that is what I want to talk to you about today. So beyond creating this insane widespread fear that hormone use of any kind contributed to increased risk of heart disease and stroke, the WHI also initially suggested that using hormones, specifically combined estrogen and progestin, which is a synthetic progesterone, increased your risk of breast cancer. Now, when we went back and actually looked at this data, we looked at when people were taking estrogen alone therapy after they had had a hysterectomy, and actually noticed that there was a decreased risk of breast cancer and there was no increased risk of all-cause mortality. We know that estrogen is important. We know that it helps with bone health, with heart health, with tissues, with helping to prevent urinary tract infections. And so what this basically tells us is that the synthetic progestins that were in this combination hormone replacement therapy might have actually been what was contributing to that increased cancer risk and not the estrogen by itself. And very importantly, on long-term follow-up of the WHI data, we saw no significant increase in all-cause mortality, heart, cancer, or any other causes between people who use hormone replacement therapy and people who did not, even after 18 years of follow-up. So for appropriately selected women, hormone therapy does not increase your overall mortality, and it can actually improve your quality of life. So despite all of the fear-mongering that came after the Women's Health Initiative was first released in 2002, we now know better. We now know that HRT is not a one-size-fits-all treatment. It is safe, and there are benefits to HRT, especially for women who are under 60, who are within 10 years of menopause, and who have moderate to severe menopause symptoms. Sadly, even though we know better, there is still a black box warning on products that contain hormones in the United States that scares physicians and patients into thinking that these hormones are dangerous, and that is something that really needs to change.